Certainly. CDK4/6 inhibitors are standard of care in advanced breast cancer and recently have moved into the early breast cancer field, trying to transform the benefits we saw in metastatic disease to the curative setting. Essentially, we have the results of two trials. One of them is the monarchE trial with abemaciclib. It has been presented first about 3 years ago. It uses 2 years of treatment and it shows an excellent benefit reduction in relative terms of the risk of metastasis by about 1/3 and an absolute difference of over 6% at 4 years of follow-up. However, the monarchE trial includes patients, only node-positive patients, patients that we would consider high risk or very high risk even. Now, very recently, another large trial, the NATALEE trial, investigating the addition of 3 years of ribociclib, that in the advanced setting has already demonstrated overall survival benefit in 3 different large trials. And it also shows in a rather early interim analysis of the trial that there is a good benefit. So the difference is that NATALEE is the younger trial. It needs more follow-up. On the other side, it includes a broader range of patients, not only the very high-risk patients, but reaching into the intermediate risk, particularly the node-negative patient population. Eventually, if this all comes through, then we could expand the indication for up to twice as many patients compared to the previous trial. Elacestrant, based on the results of the EMERALD trial, clearly is a breakthrough in advanced breast cancer oncology. Why is that? Because it's the first drug that demonstrates benefit, particularly in a group of patients whose tumors have developed a mutation, the so-called ESR1 mutation, which is a consequence of the treatment pressure we give to our patients. Now, whether it becomes standard for every second-line situation, I think is a question of debate that we also had great discussions here at the EIOC. Why is that? Because there are alternatives to this treatment. And obviously, every time something newly comes into the algorithm, we will have to figure out who is going to benefit particularly. As it looks, this would be those patients who responded for a very long time to their first-line treatment. But in any case, it's a wonderful addition to the treatment armamentarium of metastatic breast cancer.